So we do an integrated program in Mount Barker, which means no 2 days are the same. So we do a variety of stuff between working in GP, normally a day a week in the ED, the acute ward, maternity, theatres, doing anaesthetics or helping visiting surgeons, a lot of teaching as well. So Tuesday afternoons and all day Thursday we have teaching out at the ARCS office in Nairn.
Well, I think one of the great things about this year is that every week does look a bit different. So we get a roster every week from our supervisor, and that can include things like GP, and then we also might be put on the acute ward, which was what I was on today. We also might be on maternity, and we usually have one session in ED as well.
I work predominantly in the emergency department at Mount Barker Hospital. So a lot of the students' placements are in the hospital and in the emergency department proper. So I will see them when they're on the wards around the hospital, I'll see them when they're in dialysis, I'll see them when they're in theatre, I'll see them when they're in midwifery, and then I do get to work with them closely when they're in the emergency department. I do also see them 1 day a week where we do a tutorial. Sometimes we'll do our tutorials in the hospital when we do a simulation or a skills session, and we have lots of simulation equipment in the hospital and we have lots of skills that we can practice there. So procedural skills, we're really good at doing that in the hospital as well. And I get to see them in lots of various different aspects, which I think is helpful because it means that they feel like they have someone standing next to them for the entirety of their placement.
Mount Barker's a cute little town. It's developed a lot over the last couple of years and it's actually grown quite big, but I've really enjoyed it, and it's a nice spot out of the city but not too far away that you can still get in when you need to.
Yeah, the Mount Barker house is very nice. It's probably one of the more modern houses, but it's very close to the hospital, so it's only about a 3-minute drive away or a 15-minute walk if the weather's nice. And Mount Barker is a very bustling, busy town. There's lots of things to do here, and I definitely haven't explored everything.
I would say do it. And I would say if you haven't thought about going rural, then you should start thinking about going rural, because obviously when you're in a rural area, there's not so many people, there's not so many students, there's not so many registrars, no one's competing for those learning opportunities. You're in it, you get to do it, you get to experience it, and you get to have real ownership of your role within that experience, which ultimately means that what you take out of it is generally a lot more knowledge and a lot more skills.
Yeah, it's been a really nice community to be a part of. One thing that we've done is Neve and I both played women's footy this year, which was really exciting, a good way to meet lots of different people from different backgrounds. We go to a Women in Healthcare Leadership Forum once every couple of months and get to talk with some really interesting ladies there from all different backgrounds in healthcare.
One of the things that I most have loved about this year is actually the mundane things like being in charge of patient care and feeling like I'm actually doing things on my own instead of being the last person in a group. So even today, just having the nurses come and talk to me about a patient and what they would like to do. So that's probably one of the things that I've enjoyed the most about, especially this second half of the year.
Yes, I would definitely recommend coming up here. Being rural in general gives you a lot more chance to do your own thinking and parallel consult and use your brain rather than following other people around on a ward. And I think Mount Barker has had an excellent clinical experience, lots of parallel consulting, lots of different cases and lots of great teachers, so I'd highly recommend.
Yeah, I'd definitely recommend going to Mount Barker or any of the rural sites. I think Mount Barker definitely has some advantages. If you want to see a lot of things, I think Mount Barker is a really good place to go.
Our student coordinator, Lisa, is really fantastic. Our student academic, Cassie, has been really excellent as well. She's a really great role model for us girls, and she's got quite a lot of knowledge. She's worked between GP and ED, so she's really helpful in our tutes that we do on Thursdays. And, we often go out for lunch with her afterwards and sort of have a really good relationship with her, so that's great.
Specialists that we see this year, I've sat in with a paediatrician, I've sat in with a respiratory physician, I've sat in with gynecologists, I've done some work with some general surgeons and gastroenterologists, and I'm going to go and sit in with a dermatologist on Thursday. So there's lots of opportunity to sit in with specialists, and you basically just have to ask Lisa and she'll try and get you involved with anything that's up here in Mount Barker, which there's a lot of opportunity.
I would like to defend Mount Barker because some people do say that it's not a rural site. Having grown up in the Adelaide Hills and obviously have animals that need shearing, I would say that you are wrong. It is quite rural, not necessarily remote, but still quite rural. We tend to see a lot of wood cutting injuries, especially during winter. We tend to see people who have managed to cut themselves open on all sorts of farming equipment. We had a bloke who swallowed a fencing staple the other day. It is really becoming a regional centre, so it's becoming an excellent teaching site, just that next step up, just to give people that exposure to things that maybe wouldn't have been managed like this in a remote area, but we still have to manage them there, and there's a lot more because there's a lot more people. We have a whole lot of different visiting specialists and we have a whole lot of different expertise. It is still a good rural experience.